Hello, Dr. Huffman from the Medical Travel Associates. This tutorial is on medical tourism. What is medical tourism? In the future, we'll have tutorials on cost, safety, continuity of care, the engagement of your personal physician, and the pre- and post-operative process. But this is just a general concept of medical tourism. Now, medical tourism has been around forever. People have traveled miles to seek out better healthcare, lower healthcare costs for decades, centuries actually. But what's happened more recently is individuals who are paying for medical care or surgical care are seeking out globally lower costs. And that's good. You want to find the best value for your dollar. Now, what's interesting is not just patients. We are now seeing self-insured employers and even insurance companies seeking out lower cost options. So we're beginning to globalize healthcare. We travel all over. You may travel to Costa Rica for bariatric surgery. You may travel to India for orthopedic surgery. You may go to Mexico for dental procedures. On the other hand, there are people from Mexico coming to the US, people from Costa Rica going to Europe. So there's a lot of travel, and it's based on cost and outcomes. So what's driving this again is the self-pay market drove it first. If you're an individual who's paying for a surgery and you can save 60, 70, 80%, you're going to look at that option. In the future, we will discuss in future informational seminars or webinars how to select safety, because we think safety and outcome is priority one. You have to find a safe program where the surgeons in the hospital have been vetted out. We understand their infection rates and complication rates. We know that you're going to get the good service. Then look at dollar. Don't look at dollar only. Many individuals have made that mistake and found the cheapest surgery and then have had thousands or tens of thousands of dollars in post-operative complications, and you should avoid that. So future seminars will cover that topic of safety, affordability, vetting out the surgeons in the hospital. But in this video, we just wanted to discuss in general medical tourism, and that is the travel outside of your home for surgery. You may be traveling to another city in your own state. That's considered domestic medical tourism. You may be traveling from your city to another state. That's still domestic, it's within the United States. However, you may go to Mexico, Costa Rica, India, Middle East. You may be traveling internationally. And as you travel internationally, that's considered outgoing international medical tourism. Those who come into the United States from India, Middle East, Mexico are considered incoming international medical tourism. So medical tourism is simply traveling outside of your home. It can be domestically or internationally. It can be as simple as a patient seeking out a dental procedure in Mexico. It could be a large corporation in the United States who is contracted with a single hospital entity, such as a Mayo Clinic, a Cleveland Clinic, or Johns Hopkins, to provide care for their employees. Walmart recently announced an association with the Cleveland Clinic. Lowe's has a relationship with Johns Hopkins. There's other industries that are now seeking out domestic travel. So you may live in Houston and be going to Cleveland for your cardiac care. Now, what's important, what happens when you get back to Houston? Who's providing that care? Who's taking care of you beforehand, making sure that you're ready to fly and you're fit to get to Cleveland for that procedure? And when you come back, who's following up with you? So this was meant just as a brief introduction. Call us at any time at 866-270-5116, and we'll be glad to answer any questions you have on medical tourism. Look for our other videos that we'll be posting soon on continuum of care of medical tourism, finding the safe and effective outcomes that you're looking for, because it goes well beyond pricing, and we'll offer more of that in the next video. Thank you.